So we're going to now flip from the micro to the macro, the big picture issues, and the propositions that I'm going to put out for discussion draw from the privilege of having been able to have wide-ranging conversations across sectors and countries dealing with practitioners and strategists working on accountability, as well as doing a deep dive into the evidence on social accountability, as well as open government and other accountability approaches as well. So right now, just to give you a sense of where I'm coming from, I'm in the soft launch phase of trying to get off the ground an Accountability Research Center, which, as Eric mentioned, is an action research incubator that's trying to address a problem that some of us found in the research literature, which is that for many of the people actually doing the work on the front lines of accountability building, not only is there not much research, but a lot of the research that's out there is not directly relevant to them. And the usual response from researchers is to say, well, we have to do a better job of communicating our findings to practitioners. And that's certainly true, but I don't think it's the main problem. I think the main problem is that the people doing accountability work have often not had a seat at the table where the research questions are defined. So I'm very much interested in helping to broaden access to the agenda setting stage of research. And I'm doing that through trying to promote balanced partnerships between researchers and accountability strategists. So the first proposition that I want to put out here is that first, accountability is hard. We're talking about centuries of subordination and exclusion. The goals are ambitious, so when we look across the field of what's actually being done, especially, frankly, donor-led or donor-funded initiatives, we find that many accountability efforts are very small bore. They have fairly modest goals. And so when we look at the literature and see, well, there are mixed results, and this was the frame for the piece, the working paper that Eric mentioned, when we look at mixed results, a big part of the response to why are there mixed results is, to put it in medical terms, underdosage. Not enough citizen voice, not enough accountability. Just little droplets are not going to be enough to really shift the balance of power and change the interface between the state and society. And so one of the problems here is that much of the field has been led by tools as opposed to strategies. And for health systems folks who, the term strategy may be overused, in the accountability space, strategy I think has been underused. And so if we're trying to figure out in the clinics in Malawi, the interface meetings may be fine for getting the health service providers to show up on time and to improving communication. They're not necessarily going to be enough to make sure that the medicines are in the cabinet. Because the reason why the medicines are not in the cabinet may have nothing to do with what's going on in the clinic. They might have been stolen at the district level, they are maybe never budgeted for in the first place. At the national level, there are a whole range of systemic issues that may explain why there are no actual medicines. So we have to, I think, distinguish between those accountability problems that are resolvable at the micro level and those that are much more systemic, and therefore these community level initiatives are not going to be enough to address the problem. And one of the approaches that emerged out of a learning exchange with reproductive health strategists last June that we co-convened with International Planned Parenthood was we realized we need to really flip the frame. And a lot of the systems analysis approach in this field thinks about in terms of the idea of the last mile for service provision, and we basically came to the conclusion that we should flip this, and if we want to pursue a citizen-centric approach that's really going to focus on what is it going to take to create enabling environments for effective citizen action and collective action, we need to think about the interface, the clinic-citizen interface as the first mile. That's the way it looks from the citizen's point of view. It's really a top-down approach to think in terms of the last mile. And then the punchline, just to give you a preview, encourage you to take a look at this evidence review that Eric mentioned. The punchline is that voice needs teeth to have bite, but teeth may not bite without voice. And teeth here refers to the institutional capacity to respond to voice. Why would we expect citizens to invest their limited time and energy and take the perceived risk that is inherent in expressing voice if they don't think that an institutional response is likely? I remember being struck by a presentation about a different community scorecard approach in Malawi 3 years ago where a health ministry official was very frank and said, why would we expect someone to raise explicit concerns about the quality of health services and perhaps abuse or discrimination in an open meeting because the next week they may actually need to go back to that same service provider when they're in need, and are they going to basically suffer reprisals as a result of having been critical? So how do we really think hard about bring the fear factor in, as opposed to taking a more naive view about the factors that will influence whether or not people are willing to speak up? So if we, based on the evidence reviews, the takeaway here is that in this field we see more information disclosure. We see more production of information, some of which is more relevant than others. Sometimes it's lots of data as opposed to information. But the connection between transparency and accountability has many more links in the causal chain than many of these, what I'm calling small bore initiatives, assume. And so because of this, what I'm calling limited traction in terms of accountability impacts, the proposition that I'm making and sort of throwing it at the wall to see what sticks is that I'm proposing that this field of transparency, participation, and accountability needs a conceptual reboot. In other words, it's been largely based on rather optimistic assumptions about what is it going to take to really transform the way service provision works. So some of the big picture questions for discussion that I want to put out here are how can strategies for social accountability get to the causes, the underlying causes, and not just the symptoms of problems? To take the medicine stock app just as an illustration. When we think about the role of information in guiding, enabling, and empowering citizen action, what kind of information is really going to be perceived by citizens as relevant and actionable? And here the concept of targeted transparency is particularly important. Another question is how to tackle the fear factor by promoting enabling environments for collective action. What does that actually mean in practice in the inherently unique local context that many of you are working in? And then another question that's come up, and this also came through dialogue with the reproductive health practitioners, is in terms of the kinds of information that might be relevant to help citizens and their allies in public interest groups or in health systems, how to help them target advocacy and problem-solving efforts. In many health systems, there already are, as you know better than I, very elaborate monitoring systems in order to track and identify problems, but those information gathering and processing systems are rarely public-facing. So in this context, one could look across health systems and see where are there no appropriate information and performance monitoring systems at all, versus where are there already existing performance monitoring systems, but the data is not shared with public interest groups that want to help the system work better. And so how can those upwards accountability systems, in other words, most system monitoring systems are to feed upwards accountability to donors and governments, how can those already existing information and monitoring systems be harnessed for downwards accountability, accountability towards citizens? Another dilemma in the field is how to find synergy between preventative and reactive approaches. Examples of reactive social accountability institutions would be, say, grievance redress mechanisms. But in systems that have deep accountability problems, reactive approaches are rarely going to be able to address more than a tiny fraction of the actual problem. So how can a systemic approach to accountability building tackle the causes? This gets back to the cause-symptom distinction. The causes of, again, say, medicine stock-up, just to take one example, or the causes of abuse. Much of the evaluation research on frontline health worker behavior, there is a tendency to take a certain carrots and sticks approach. For example, to manipulate the behavior, whether or not the nurses are going to show up and that sort of thing. Well, that's a reactive approach that treats the motivation of the service provider as a black box that is manipulable through incentives and sanctions, as opposed to looking at what is the system that produces the training, the recruitment, and the system of incentives that they face within the system. So how do you essentially go upstream in order to tackle the underlying causes of, for example, abuse and discrimination? Another challenge in the field is how can supply side and demand side changes, meaning basically the state side and the society side, how can they be articulated in order to find mutual synergy, where there are actors within the state and within accountability institutions that are trying to help enabling environments, build state capacity to respond to grievances and problem-solving initiatives, and how can that process find synergy with citizen action, citizen voice, and so forth. And then one more question, and the one that I've been looking at in greater depth lately, is how to scale accountability. And so here, I want to, the think piece on the table here, it's way too long, but here one of the main takeaways from this think piece is to distinguish between scaling up in the sense of doing more volume of X versus taking scale into account. So if we again come back to the illustration of medicine stockouts, we can say, how can a multi-level process of monitoring how resources are allocated and how medicines flow through the system, how can that vertically integrated mirror supply chain oversight process really identify with precision where the leakage is, where the problems are, as opposed to being limited to what the environmental policy analysts would call the end of the pipe. And so here I want to contrast this idea of scaling accountability with scaling up by talking about the importance of taking scale into account with multi-level monitoring and advocacy, two processes that often do not go together. But the argument that I want to make is we need to think more about how to build that synergy between monitoring and advocacy. So the rationale for this multi-level focus is first this follow the money approach to plug leaks throughout the supply chain. And I'm using this as a broad metaphor, not just to refer to stuff, but also to refer to training and recruitment, incentives, and so forth that affect the quality of care. The proposition here is that purely localized approaches, like scorecards, aren't able to address the upstream problems. At the same time, those looking nationally, for example, those looking exclusively at procurement at the national level, they're going to have trouble addressing the downstream problems. And the rationale here also emphasizes the way in which anti-accountability forces respond to oversight efforts, which is, I try to capture with this metaphor of squeezing the balloon. You go to the district level and they say, well, the problem's really at the national level. You go to the national level and they say, the problem's really at the district level. You go back to the district level and say, the problem's really at the local level. And they're constantly passing the buck. And the only way in which an accountability strategy can account for that is to be able to figure out who exactly is doing what at each stage in the decision-making process. Because when they say at the district level the problem's at the national level, sometimes it is true. How do you know when it's true and when are they simply trying to sidestep the oversight effort? And so the squeezing the balloon, I think, is a pretty widespread problem. And so underlying all of this is an emphasis on trying to build a power analysis into the strategy. One of the elements of what I'm calling a small bore approach is an approach that deals with accountability without taking into account power relations and the importance of redistributing and shifting the balance of power. So how, in that context, how can we build countervailing power into our approaches? So this is just a little diagram that tries to talk about the search for synergy between advocacy and monitoring. On the one hand, how can the monitoring inform the advocacy? How can the advocacy inform the monitoring? And how to do that simultaneously across multiple levels. So just to briefly add the caveat that I'm not claiming this is a magic bullet by any means. When we scan the field to look at what multi-level approaches are already being pursued, many of them look at the connections between maybe 2 or 3 levels, from local to district or from provincial to national, not necessarily looking at the full picture, but looking at more than one level, I'm arguing, is already a big step. And so partial vertical integration can help. We could talk about multi-stakeholder coalitions to pursue this. We can talk about the challenges in building partnerships between civil society organizations and the state. How can each side begin to trust and rely on the other when from each one's point of view, the other one is kind of shaky and unreliable? Really the underlying conceptual challenge, the cross-cutting challenge here for pro-accountability forces is how to, starting from a low accountability equilibrium, a situation in which pro-accountability forces in both state and society are relatively weak, how through mutual interaction and mutual empowerment can they trigger virtuous circles so that the whole can be greater than the sum of the parts. So that's what I'm going to wrap up with. I'm really curious what resonates here, and I'm curious whether or some of you may be involved in these multi-level approaches to accountability building. And with that, I'll turn it back over to Eric. Thank you very much.